Is the use of more widespread COVID-19 testing an underutilized resource to fight this pandemic? And is the expense of taking it a big part of the problem? We asked public health and family physician of Health Plus Associates, Dr. Orville Nemhart, to share his views. Good morning, Doc. Always a pleasure to have you.
Hi, morning, Daniel.
How are you? I hope you don't mind being in the hot seat.
Morning, Carol. No, not at all.
Okay, fantastic. First of all, we've been speaking about these tests. You know, we hear PCR thrown around, we hear antigen. Everyone is just so confused, and one is more expensive and the other one isn't. So just break it down for our viewers firstly. PCR versus antigen, what are those?
Okay, when the world was introduced to COVID-19 in 2020, the only test available to confirm the presence of the virus was the PCR, so-called polymerase chain reaction. It's a fairly complex test, and it requires a high level of laboratory work to be able to get a positive result. In 2020, antigen tests came around, and these antigen tests were labeled game changers because what they allowed was for an individual to do a test and get a result within 10, 15 minutes. These are tests which are labeled point of care tests, similar to the dengue test, which can be done in office, pregnancy test, a urinalysis, blood glucose. These are point of care tests. That was the aim of these tests, to be able to give you a rapid response. The cost of the antigen test is far lower than what it is for the PCR. And the turnaround time, as I said, is much greater. I mean, within 15 minutes with the antigen test, whereas it is maybe 24 hours or more, depending on the lab and the process that they use, before you can get a result for PCR.
Yeah, but what makes the difference, Doc? Because there are instances now, and this is part of the conversation, where people say, well, I'm going to get a false negative. The antigen said I don't have COVID-19, but then I went under the PCR and it said I did. What makes the difference between both?
Okay, without getting into the technicalities of behind what we have, sensitivity and specificity.
Right.
What you find is that the PCR is what we call the gold standard. It's highly specific, it's highly sensitive. So if there is even almost one virus particle there, it's going to find it. The antigen test, although it's highly specific, isn't as sensitive. So it may miss an infection if it is that the viral load there isn't great. So whereas if you get a positive result with the antigen test, 9 out of 10, that's it, it is positive. If you get a negative result, there may be some room for discussion, which is not unlike what happens with a pregnancy test. It may be that you didn't take the right sample, meaning an early morning sample. It may have been too early in the pregnancy to pick it up, but that's what your clinical skills are supposed to help you to do, to be able to say to this person, listen, although this test came back negative, based on what we're seeing, you probably do need to go on to a PCR, or perhaps you come back in another day or two to repeat the antigen test. There's no magic to this. It's a point of care test. It's open to interpretation. If you understand how the test works, you're able to advise the person appropriately.
Okay, and Dr. Nemhart, let me ask you a question. Dale and I were speaking earlier. We're speaking about everyone having this individual responsibility. Some of us travel, sometimes we're in contact with other persons. Therefore, we have to rely on ourselves to go and get the tests. And this is where the question becomes, you know, are these costs prohibitive? If these costs were lower, do we believe, or is it assumed that maybe persons would be more amenable to going and taking that test to ensure that, okay, I am negative? Like, is it one of the reasons why persons don't do it as much?
Cost is always an issue. And in the Jamaican context, the cost for the antigen is still high. It's still, in comparison to the PCR, it's probably a third or less, nonetheless.
Correct.
The pricing for the antigen test, that is a hot potato. I will stay in my public health lane and leave the pricing issues to persons perhaps better suited to that discussion.
Okay. All right.
Fair. That's
fair enough. Fair enough. So let's leave the pricing issue and talk about some other things. Well, one of the things I wanted to know, even though you're in the public health, does insurance cover the COVID testing? Because I think that's
Um,
another. No, not you.
some insurance companies have said they do, but there are various stipulations with respect to it. One of the challenges we have is that there's a fair amount of administrative or bureaucratic confusion in the marketplace. The Ministry of Health went ahead and approved certain entities to do antigen testing,
Right.
and they have restricted access to the kits for practitioners and other persons. JANAC entered the fray and said, listen, we are prepared to certify persons if you meet certain criteria. Those of us who have gone ahead and done so, we have achieved the JANAC certification since February of this year. However, the Ministry of Health still refuses to recognize our certificates when we submit them, and tells the patients when they give them that we're an unapproved lab. It has created a number of issues where patients have come back to us labeling us scammers and less pleasant adjectives. I actually have in my office a computer which has the JANAC website bookmarked, so that when persons come in and say this, I simply pull up the JANAC website, which shows them that we are in fact registered. Now, the JANAC protocol itself says that once we are registered with them, they're the ones who will inform the Ministry of Health, and the Ministry of Health should then move on to putting us on their approved list of testers. That has not happened.
Yeah.
I can't speak to what is the thinking behind that. It almost appears as if there is a territorial and jurisdictional war between the Ministry of Health and the Ministry of Industry and Commerce, which is who I think is in charge of JANAC. So unless that gets sorted out, what's happening is that we, the public, and the fight against COVID-19 disease is being hampered because practitioners are limited in getting the kits. If they get the kits and attempt to report it, the ministry isn't accepting it. So there is an undercount, quite frankly, of the number of cases that are out there.
What?
This was going to be my question. I just wanted to give you an opportunity to finish your thought, Dr. Nemar, because I heard what you said earlier in terms of, even if you are JANAC certified, if the Ministry of Health and Wellness is not approving it, then my question would have been, so how does that account for the counts? If we're not counting or accounting for these particular results that are coming in from JANAC certified tests, then can we safely say that these numbers might actually be worse?
Certainly from my own perspective, given the number of positives we see in our testing per day, and knowing that those numbers are not being accounted for in the ministry, and I know we are not alone in this scenario. I think it's safe to say that we do not have a handle on the true numbers of COVID-19 positive cases in the island.
Doc, that's very troubling what you've just said to us, because there seem to be quite a number of entities such as yourself who are in this dilemma of being certified by, and if you're one person saying the numbers are great coming through you, I can't imagine what the others are, apart from the fact that it doesn't give us a real reflection of what's happening with the pandemic. Aren't we also in jeopardy of not treating it properly? Because the patients are coming, getting tested by you and other entities, and the ministry says, well, I can't acknowledge it. Are we having COVID positive people going home and saying, well...
And saying, I can't bother do it again?
Well, let me give you one example. We had a patient who came in and said there was a flu going around her office. She was like number 5 in line to get this flu. Did her test. It came up positive. Sent her into the ministry. Typical response: you're not an approved lab. We're not accepting it. You need to do a PCR. They gave her an appointment for 2 days down the line to get a PCR. She did the PCR 2 days down the line. The result came back 4 days later. It is positive. We have lost 1 week in terms of addressing this situation. This is the value of the antigen test. I can't understand why it is that we're holding back on it. In the previous outbreak that we had in March, April, whenever, we had a number of persons who came in positive. My thing is that once somebody comes in positive, there are a couple of questions we ask. Who else is at home? So we try to get an idea of what the exposure is, what they need to do in terms of protection, and who else is coming and going, right? We ask whether the individual goes out to work or they are working from home. If they are going out to work, we encourage them to share the information with the workplace so that they can do the necessary steps right away. And we ask them who have been their social contacts over the last week.
Yes.
If they've been to the bar, been party, a dinner party, that sort of stuff. That way we're beginning to get contacts. Out of this, we have had families and extended families which are positive. We have found workplace clusters. There's one in particular in which there were 15 members in the workplace, 9 of which came back positive on the first go. There was another one, 6 persons in a department, 4 of which came back positive. None of these numbers the ministry has.
So, Doc, let me ask you this. So does that mean that for those of us who are interested in taking our test, this is something that we may now have to ask or to ensure, for example, that this test that we're doing is MOHW approved in order to prevent what you're discussing from happening to us? Is it something that
really
the public now has to do it?
I'm really not sure where the ball bounces in this. JANAC is the certifying agency. JANAC is the agency which approved the Ministry of Health's own laboratory. What is the logic behind the Ministry of Health now looking at JANAC and saying, well, you have made this approval, but somehow we're not accepting your approval? I don't understand where the discussion needs to go for some resolution to be had for this.
No, I know. I absolutely understand, and I can sense the urgency as well as the frustration. We tried to invite JANAC, but they were unable to join us for this morning. But thank you so very much.
I wanted to ask him something quickly, Terry. Sorry, I know
No,
we're
man,
out
go
of
right
time.
ahead. No, man,
But
go
you
ahead.
said something that's very critical, Doc, and it's something that's happening more and more. I'm meeting people who keep saying to me, oh, there's a flu going around. There's a bad flu. Symptoms of COVID-19, but they're saying it's a bad flu. Are you encountering more and more people who are saying it's just a flu, but then it turns out to be
Downplaying
COVID-19?
it.
Absolutely, yes. And this is precisely the narrative of the Delta variant. Whereas with the previous variants, you had more of the loss of taste, the loss of smell, and so on. The Delta variant presents as a bad flu. And so what we have is patients who are coming and saying, well, I got wet, in the rain. I have the flu. Another gentleman just yesterday who said, well, he drove to the country with the AC high in his car, and he spent the night and it was cold there and he came back and his test is positive. Wow. This is what we're seeing. But without doing the antigen testing, getting these results quickly and being able to intervene quickly, we're not in the game as far as managing COVID-19 disease.
I hear that. And I thank you for your openness and your transparency. It has been extremely instructive, and hopefully persons listening can take this very seriously, that they look at the symptoms and realize that it is not right to assume. Right now, the best bet is to just get that test and to take it from there. Dr. Orville Nemard, Public Health and Family Physician of Health Plus Associates. Thank you so very much. We absolutely appreciated having you here with us today.
Yeah.
Thank you.
No problem. Have a good one and be safe.